Hi everyone, Michelle here again. It's now been just about 20 days after my strabismus surgery now, and as you can see, my eyes are looking pretty good. I have now the swelling in my eye is pretty much gone down. Even the shape of my eye, I'm noticing, is returning a little bit more to a normal state. Obviously, the best thing that has happened from this surgery is that my eyes now are looking pretty much straight, dead on. It's hard for me or for anyone else to notice if there is a misalignment. It's very difficult to detect. I'm still working on the tracking of my eyes, making sure that when I move them to the left or to the right, that they're moving together. I'll start vision therapy up at the end of this month, which is just next week, and hopefully then I'll also have a post-operation appointment with my surgeon to see, how straight my eyes are and find out whether or not a second surgery will be necessary. I do still have a little bit of double vision, but it's getting to be so unnoticeable. It's getting to the point where if I notice the double vision, it's just a little bit off from where my normal vision is, and that's not too difficult to deal with. One of the things that has been growing within me is a little higher degree of self-confidence. I have to say this was the best thing I ever could have done for myself. It's making me feel more value and self-worth. It's making me feel more confident. Inwardly, it's actually increasing my desire to become a better person, to be able to reach out and start to form relationships with others. I love to hear from people all around the world and the country who've been following my blog, who've been following me on this journey. And I'm going to get a little emotional because they understand. Hang on just a second. They understand the pain and the difficulty that I've been struggling with all my life. They understand what it feels like to live with an eye that crosses in or out, the unsightliness, what it does. In fact, I have one friend now that I've developed along this journey who is seeking treatment, who is going to meet with the surgeon, my surgeon, next week, and I'm going to go with her. And she's she's going to come with me on my post-op, and she's actually going to go in and get an evaluation done because she knows there's hope now. There's hope for her just like there was hope for me. So that's encouraging, that I feel like this story needs to be told. And that's why I have published it. I want everybody to know that they do not have to choose to live with strabismus all their life. They don't have to choose to deal with the consequences, that the lies that have been told by the doctors that there's nothing that they can do for you, that's wrong. The optometrist will tell you that there's nothing that they can do for you, but that's not the real story. If you seek surgical correction and you couple that with vision therapy, you can have some pretty positive effects. It's going to be way better than what you're living with now. So those of you that are suffering with strabismus, please just know that you can step out in faith, that you can step out in the hope that you can have a better future and a better tomorrow. So again, I just thank you all for continuing to follow me. Obviously, I have a long way to travel on my journey. I have not been able to restore 3D vision yet, but that is going to happen. I am confident that I'll be able to do that. But for now, what I see, what I look like is so much improved from what I was in the past that even if I had no other benefits other than a correction of the alignment of my eye, this has transformed my life. And this journey has been so well worth it. So I just encourage you, if you know someone who has strabismus, whose eyes turn in or out, or maybe both, tell them to look at my blog. Tell them that there is hope out there and that there is a way for them to experience a whole new life and to move on to become the best that they can be inside and outside. So for now, signing off. I will return and do another video blog after I've met with my doctor so that you can hear about what he has to say about my future. Take care, and thanks again for following me.